Women's Health Wednesday now. November is Pancreatic Cancer Awareness Month, and there is a rising incidence of pancreatic cancer in younger women right now. Pancreatic cancer has the highest mortality rate of all major cancers, which is why further research is needed to develop more effective treatments and better outcomes. Dr. Rebecca Keim, a surgeon with St. Peter's Hepatobiliary and Pancreatic Surgery, is here now with important information for all of us. Dr. Keim, thanks for coming in.
Yeah, thank you for having me.
So we know that this is a tough diagnosis for people, and it has, as we mentioned, one of the highest mortality rates. Why is that?
Well, there's a couple reasons. First of all, people tend to be diagnosed at a later stage, so advanced stage of diagnosis, stage 4 or stage 3. Also, the signs and symptoms are quite subtle for quite a long time before people determine that that's the cause of their symptoms. And unfortunately, there's no really good way to screen for the disease, so we tend to find people when they're symptomatic at a higher stage. In addition, when we do have treatment, including chemo and radiation, even if everything goes well, there's a high chance of it coming back. Many people feel that pancreatic cancer is sort of micrometastatic at any stage, and therefore, any chance of a cure long term is going to be really systemic therapy and development such as that.
So awareness is really key here, and you mentioned some of those symptoms, and it takes a while for you even to understand if these symptoms could be related. So let's talk first, if we could, about some of the digestive symptoms that people might experience.
Right. The classic one people talk about is upper abdominal pain, so pain in the upper abdomen, sometimes radiating to the back. Yeah. Something we call early satiety, meaning you eat a small amount of food and then you feel full. But again, those are subtle symptoms that people attribute to heartburn, reflux, things like that.
Right.
At a little bit more advanced stage, people become jaundiced, so that could be yellowing of the eyes or skin, dark urine, light-colored stools. So those are some of the digestive symptoms we would look for.
Okay, and then the symptoms overall can be, again, they could be attributed to so many different things, but what are some of the more general symptoms here?
So unintentional weight loss, for one, weakness, fatigue. Sometimes, too, people can develop new onset diabetes or worsening of the diabetes they already have. And again, loss of appetite. Yeah,
we can put some of those general symptoms up on the screen for everybody as well as we continue to talk here. So why do you think, and I know it's hard to exactly pinpoint, but that more younger women seem to be diagnosed? Do we have any theories here?
Right. Well, the paper that was most interesting to me, as a paper came out in 2023 in the Journal of Gastroenterology, they did a big nationwide data kind of dunk to try to see the risks of age and sex on pancreas cancer incidence. Yeah. First of all, pancreas cancer is increasing in all ages, all genders yearly, approximately 100% overall. Yeah. But then when they looked at the women under 55 compared to the men under 55, the rate of change per year was increasing. So women's change in risk, was about 2% per year, and men's was less than 1. And that continued to widen even at younger ages, so 35 and under, even under 35.
Wow.
And this, sometimes, again, with all women diseases of women, it's not as well studied as in men. So once we've discovered that this is a finding, they're trying to figure out why, right? So what risk factors perhaps apply to women more or more applicable to young women. So for example, we think that there is more tobacco use and alcohol use in younger women. That could then put them at risk for cancer later in life. Obesity is a big risk factor now, and perhaps obesity in younger women is putting them at higher risk at an earlier age.
And we hear about alcohol related to so many increases in all types of cancer.
Correct. People always think about smoking, right? Alcohol is just as potent of a carcinogen. It's just not as well defined. And really, we realize that obesity is the same. So those three are the modifiable risk factors for pancreas cancer and for all cancers that we can work on as individuals.
All right, I know there's obviously, in terms of treatment, surgery, radiation, chemo, all of these things are used depending upon what you're dealing with.
Correct.
Yeah.
Correct. Yep.
Thank you so much for coming in. We're out of time already, but I appreciate you spreading this awareness. And of course, research, right? More research, so hopefully we can have some better outcomes for people here.
Most definitely.
Thanks, Dr.
Thank you.
For more resources and to find all of our Women's Health Wednesday segments online, head to news10.com. Look for Women's Health under the Community tab. We'll be right back.